Hello, my name is Subhash, and in this video I'm going to highlight the common One Health issues. After watching this video, you will be able to understand how the animal health and environmental health have impact on the human health, and you will be able to understand importance of One Health. This video will be useful to the students as well as anyone who is interested in learning more about One Health and sustainability. Before I talk about One Health issues, I want to highlight One Health is nothing but an approach which recognizes that the health of the people is closely connected to the health of the animals and our shared environment. One Health is defined as a collaborative, multisectoral, transdisciplinary approach working at local, national and global levels to achieve or to attain optimal health and well-being outcomes by recognizing the interconnection between people, animals, plants and the shared environment. Okay, now I'm going to highlight what are the common One Health issues. So there are a number of issues, but I'm going to highlight the major One Health issues, or we can say common One Health issues. So the issue number one is zoonotic diseases. So what is meant by zoonotic diseases? Zoonotic diseases are nothing but the diseases or the illness which spreads between the people and animals. So according to some estimates, about 75% emerging human infectious diseases are from animal origin, and every year 2.5 billion people are becoming sick because of these zoonotic diseases, and 2.7 million deaths are caused by zoonotic diseases every year. And you can understand the importance of animal health and its impact on the human health. So just one example to convince you how the animal health is important. You take the example of this one, rabies. Every year 56,000 deaths are caused by rabies. Okay, so point number two, or the common One Health issue number two, antimicrobial resistance. Antimicrobial resistance, this one is a very big challenge to the global community, because if the global community doesn't act in time, this one can become a big disaster. So the current estimates suggest that at least or more than 700,000 people die every year because of the antimicrobial resistance to the drugs and antibiotics. And it is estimated that if the global community doesn't act now, around or about 10 million deaths per year will be caused by antimicrobial resistance by 2050. So you can understand the gravity of this challenge and importance of addressing this risk or the threat caused by antimicrobial resistance. Okay, the issue number three, food security. Globally, around 9% people are food insecure. And what is meant by food security? Because each and every person, all the time, they should have access to the sufficient, safe and nutritious food. So, but it's not happening. because currently 1 in 9 people go to bed hungry. And if we consider the global population, that means around 11.11% global population go in bed hungry. And interesting thing is that around 14% food is wasted after the harvest till it reach to the household. So you can see this one is one of the challenge to deal with the food security. Okay, One Health issue number 4, food safety. Food safety. So, for example, when the food is contaminated, people will have the food poisoning. So, in the process of the food production or processing or distribution or preparation, when the contaminated water is used or it is not handled properly, so that's why the food contamination happens, and when the people consume the contaminated food, their health is affected. According to global estimates, 420,000 deaths are caused because of the food contamination, and this number of people, 420,000 people die every year because of the food contamination. So, for example, in agriculture, contaminated water is used for the irrigation. So, definitely the fruits as well as vegetables may be contaminated with the contaminants from the water, and this is also a big issue because 420,000 people are dying every year because of the food contamination. So, contaminated water or ice, which is utilized in preparing the food or in the restaurants or other households. Okay, so point number 5, vector-borne diseases. Globally, more than 17% of all the infectious diseases are caused by vector-borne diseases. So, vector-borne diseases means the diseases caused by blood-sucking arthropods, for example, mosquitoes. So, dengue fever, malaria. So, these are some examples. So, according to World Health Organization's estimates, so at least or more than 700,000 deaths are caused by vector-borne diseases. So here you can understand the gravity of the problem and how much disease burden is caused by the vector-borne diseases. Okay, the health issue number 6, environmental contamination. Environmental contamination because environment should be healthy for the human's health as well as animals' health. Because if environment is not healthy, humans, animals, plants cannot be healthy. So for this purpose, the environment should be healthy. So environmental contamination, as a global estimate, around 13 million deaths are caused by environmental contamination. So either by working or living in unhealthy environment. So around 13,000 million deaths are caused by either living or working in unhealthy environment. And air pollution. So air pollution is a big issue because if we are going to have the clean air, and if we are breathing the polluted air, so this air pollution alone causes around 7 million deaths every year, and it is estimated that around 24% of the global deaths are attributed to the environmental health, or when the environment is not healthy or environmental contamination happens, so that one can affect the human health. Okay, the issue number 7, last one but most important, global climate change, or you can say global warming. This one, because if you see what's happening around the world, for example, heat waves or heavy rainstorms, then severe and frequent floods and frequent droughts or frequent wildfires. So all these are attributed to the global climate change, or you can say global warming. And according to World Health Organization's estimates, it is estimated that 250,000 deaths, additional deaths, will be caused by the global climate change. And these 250,000 additional deaths per year between 2030 and 2050, or 2030 and 2050, if the global community doesn't act in this 10 years time. This problem is going to become very complicated, and we will have a global disaster if the global community doesn't act on this one. So to summarize, the common One Health issues are, these are the 7 global One Health issues: zoonotic diseases, antimicrobial resistance, food security, food safety, vector-borne diseases, environmental contamination, and last one but most important, global climate change. So you can, based on these figures and facts, you can understand how One Health is important for the health of the humans, animals, and that's why we have to promote the One Health to achieve the optimal health and well-being for the humans, animals, and plants, for the better health. So One Health needs to be promoted because One Health approach has the potential to save millions of lives. Thank you very much for watching.